This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
Good morning.
Good morning.
How are you?
I'm very well.
We're going to talk about Medicine 3.0, which has come up in quite a few of the deconstructing anti-aging podcasts that we've done.
Yes, it has.
And some of it for me is, well, you guys are doctors. Why isn't everyone just doing that kind of care? So some of it is really confusing to me because there's the 2.0, which is that what everyone does. And now the 3.0 has become like the most searched.
Yeah, let's go
Google
into
term.
Those definitions a little bit.
Yeah.
We can thank Peter Attia, a physician, extremely well known in the anti-aging longevity circles, was thinking about this a decade before anybody else, it seemed to me. And he's coined this phrase, medicine 3.0. And what I believe is the meaning of all of this is that medicine 1.0 is basically leeches and witchcraft. And then 2.0 is what we've been practicing as physicians, looking at diagnosing things, treating them, and treating them very well most of the time.
Wait, what would you say leeches, what falls under leeches and witchcraft?
Leeches and witchcraft. I mean, just very basic, not...
like homeopathic or?
Not necessarily, just what seemed to work back then thousands of years ago, or hundreds of years ago at least. Medicine 2.0 has really probably, 200-300 years of some directed medical care for various illnesses, some of which made sense, some of which didn't. But now we're very good at 2.0. We're good at diagnosing. We're good at treating, whether it's surgery or medication or anything. We've done really well with that. 3.0 is looking ahead, trying to diagnose things at the earliest stage, or actually even better, doing things to prevent illnesses.
Right.
And that's what we mean by 3.0.
And I know like Dr. Viglione talked about medicine 3.0 and having it really be about that consultation process, which I really like. So that consultation process would be completely different with 3.0.
Well, not really, because when we do a consultation for a physician who's basically in the tradition of physicians now, doing a 2.0 interview is asking all the same questions that you'd be asking for 3.0. We just look at that and have tools now to be able to diagnose things way before symptoms arise. So in 2.0, you'd be asking about symptoms, or you're asking family history or past history of somebody. In 3.0, we're looking further than that. We're looking at their lifestyle. We're looking at their body shape and anticipating things that can be a problem.
But that would be a different type of consult, because I don't think in my internal medicine visits, anyone is asking me about my sleep necessarily, or about what I'm eating, or my physical fitness level, my strength. Well, so I think it is a little bit more involved in the consultation.
Yes, it is more involved, but that's a matter of the time, and that's the direction. But the plan is to try to predict, to try to find things early, and we've got lots of ways of doing that. The consultation is one way, but other ways are diagnostic tests, blood screens, looking for things, but rather than waiting for somebody to have symptoms. It's basically symptomless issues that we can get from history, from family history, or from investigations.
Yeah. And then there's like the blood panels. I know in our office, I think sometimes we just click a panel and we don't think much about it. But recently we've brought in more extensive panels, and we put them together with a lot of thought for different things. Would that fall into 3.0, those types of panels?
Yes, it would. Because we're just looking at things more in depth than have been looked at previously, because now we have more knowledge. But unfortunately, for most physicians, they don't have the time to look that directly into somebody's background and history and lab work. They do the routine stuff, the routine screening. But if we take one of the things that Peter Attia talks about are the four horsemen, the main things that we need to try to avoid, the reasons for people dying. And one of those is cancer, one of them is diabetes, one of them is atherosclerotic disease, and one of them is neurological disease. And there are things that we can do to evaluate those. So if we look at the cancer risk, let's take the example of Gallery, which we talked about on a podcast recently, of doing a single blood test that can pick up to 150 different types of cancers when they are otherwise really not able to be diagnosed and they're before symptoms occur. That's the obvious example of working with cancer. Now, there are other screening tests for cancer, but they're actually none as accurate as the Gallery test. And that's one of the huge breakthroughs of this century, in my opinion. So just looking ahead, doing the lab work, seeing that somebody has a slight imbalance of their lipids or one particular cholesterol level is elevated, indicating that somebody's more at risk. So we can start looking at those things and telling them what to do, how to change their diet, change their activity, and stay healthy. It's all about health span, not lifespan. We're not so interested in just keeping somebody alive longer. We want them to have a longer, more productive life.
Yeah.
So they can be in their prime for a longer period of time.
Right. But it's looking at everything, not one thing.
Absolutely.
Yeah.
Yeah. That's what you do in the consultation. So in fact, you're right, but most of the physicians that are really looking hard and trying to develop this idea or this plan of doing 3.0, they're not really referring it to 3.0. They're just doing that. And it's because they're spending more time with patients. They're looking harder at patients. And unfortunately, that is sometimes pretty expensive.
Yeah. So in a way, it's like it is about that really complete consultation. Just to say, it's a
thorough consultation and more, because
Yeah.
we've got to do the diagnostic testing. Whether we're doing a DEXA body composition, looking for visceral fat, we know that somebody is at more risk for atherosclerotic disease than if they are lean. Or doing a full body MRI, just looking for everything, or the Gallery test, looking for these DNA methylation tags that will point us in the direction of a particular cancer.
Yeah. Well, I've heard you on some phone consults recently where you're really implementing the 3.0, and it is very different what you're saying, and your plan of action is much different than it was before. So I like it. I think it's great.
Thank you for the compliment, but I'm just in a little more detail now than I was previously.
Yeah, it's great.
So I don't think it's hugely different from what I was doing before. But honestly, just because of people like Peter Attia, I've learned more.
Yeah, I think it's great.
And so I'm better able to help patients now.
Thanks for listening. And if you have more questions, please let us know, either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.